Assalamu alaikum wa rahmatullah. Alhamdulillah, this is Nas Rahmatullah, and this is a part 2 of Let's Talk About UTI. Inshallah, today in this video, we will talk about how UTI occurs and what are some of the practical tips that we can take to protect ourselves from UTI. So, UTI is short for urinary tract infection. How does it occur? It occurs when bacteria, viruses, or fungi invades the urinary tract system. Now think of your urinary tract system as a tube system inside your body. It starts from the kidneys. Kidneys are like tiny filters that helps to clean the blood. Kidneys clean the blood and also makes urine. So from the kidneys, the urine travels down to the bladder through a tube called ureter. Then from the ureter, from the kidneys through the ureter, the urine travels to the bladder. The bladder is like a balloon that holds the urine up until when you are urged to pee. Then when you finally go to pee, this urine travels through a tube called urethra. This is the urinary tract system. UTI is common more in women than men due to our anatomical differences, inshallah. So how do we protect ourselves? What are some of the practical tips to prevent ourselves from getting infected? Inshallah, first on our list is to stay hydrated. Always drink plenty of water throughout the day to help flush out bacteria from the urinary system. Drink about 7 to 8 cups of water per day. Now this will help to flush out every bacteria through the urethra, inshallah. Number 2 on our list is to practice good hygiene. I would like to emphasize on this point because this is one of the things where women get everything wrong, and this is why it keeps reoccurring no matter the amount of antibiotics you take. So how do we keep ourselves, how do we maintain good hygiene so we cannot get infected? Number 1, always wash your hands. Because if you do not wash your hands and then you visit the bathroom to pee or poo, you are using those same hands to clean yourself. If you could remember during the COVID, we are always advised to wash our hands. That is because we can have germs on our hands that we cannot see. So it's always important to wash your hands, especially before you visit the bathroom. When you're urged and you want to go to the bathroom, always make sure your hands are clean, because those are the same hands you will use to clean yourself. That's number 1. Number 2, always make sure your toilet seat is dry before you sit on it, because bacteria or germs, they love places that are moist, wet places. That is where they live. They can survive in there. So you don't want to get affected or get infected by not drying the toilet seat before you sit on it. So always wipe it, make sure it's dry, then you sit on it, inshallah. Then after you sit on it and you do your business, either number 1 or number 2, meaning pee or poo, how do you clean yourself? This is also another very, very important point. The ways or the way in which we clean ourselves is very, very important. The method of doing it is very important. How do we do it? The anatomical difference here between men and women is that for women, our genitals are very, very close to each other. Very, very close. The rectum and the other one, very, very close to each other. So how do we clean yourself? How do we clean ourselves? For those that are using water, as Muslims, we use water. So how do we do it? Make sure when you are washing yourself, first, your hands should be very clean. Then wash here from the force, then to the back. Start from the front, then to the back. Do not touch the front after touching the back. Always make sure you wash the front first, then come to the back. Don't do this. Don't bring the back like this. Now, this is what a lot of people do. People do it like this. So when patients often the time when they come to the hospital and I ask them about this method, how do we do it? They will say, this is how we do it. And this is not how you do it. Meaning you bring from the back to the front to the back. That is not how you do it. If you do it, you're bringing some bacteria here to the front. And you don't want to bring here, you don't want to bring some bacteria from the rectum to the front part. You don't want to do that. Because if you do that, the bacteria will now travel through the urethra. Remember, the urethra is the tube that brings the urine from the bladder. So you don't want the urethra to get infected. You don't want that. So you want to protect it by all means. So try your best to wash the front first, then to the back. Once your hand touches the back, don't touch the front, because you will not be able to see the germs or the bacteria in your hands. But if the moment you do this, you're transferring bacteria from like cross contamination, and you don't want to do that. So that's a point that we should be very, very careful on how we do it, inshallah, to protect ourselves from getting infected. After you do that, dry the place. Make sure it's clean. Make sure it's clean and it's dry. Also, for those that are using wipes, I think it is more hygiene to use water than wipe it than just using wipes. For those using wipes, also make sure you wipe the front first, then to the back. Don't wipe like this. And even if you use water to wash yourself, use the wipes or use the toilet tissue to dry yourself. And in drying also, follow the same procedure. Dry here first, then to the back. Don't do this, inshallah. This is a point where I want us to really be very careful, because it's very, very important. Be very, very careful when we go to the toilet, and how we wash ourselves is very, very important. Then after that, wash your hands. Make sure you dry the place. It's not wet. Make sure the place is not wet, because like I said earlier, bacteria, they love places that are wet, places that are moist. They can survive in those places. And you don't want to give them a chance to survive in there, because you're trying to protect yourself from getting infected. From there, inshallah, you wash your hands again, dry yourself, dry the toilet seat for the next user. It is very, very important. Don't just use the toilet seat and leave like that. You want to make sure the next user is also protected. So always dry the toilet seat when leaving. Make sure it's dry before you sit on it, but also make sure it's dry before you leave, inshallah, and then wash your hands. Now, that's number 2. Number 3, urinate regularly. Do not hold the urine for so long. Many people have this habit, like you hold the urine for so long, and when you finally, when it cannot be held anymore, you just start rushing and running to the bathroom. That is not good. That is not healthy. By holding the urine in the bladder, you are multiplying, like the bacteria will keep multiplying, because you're not flushing them out. So always go to the bathroom, urinate if you have the urge to, but do not hold the urine, inshallah. It only helps to multiply the bacteria. Like it does more harm than good to your system. So do not hold the urine. No matter how busy you are and you have the urge to go to the bathroom, just know that the bladder is telling you, I am full, I need to be emptied. So just go and urinate, inshallah. Number 3 on our list is to urinate after sexual intercourse, like post-sexual activity. Always make sure you urinate. It is very, very beneficial to urinate immediately after intercourse. This will help to flush out any bacteria that might have entered during the activity. So it's very, very important. Urinate immediately after you have the intercourse, inshallah. That's number 4. Number 5 is to wear breathable underwears. Always wear breathable underwear. It should be cotton, and when it's cotton, it allows for a better airflow. It allows better airflow. Also avoid tight fitting underwears, tight fitting clothes, tight fitting underwears, because otherwise that could trap moisture. especially if it's nylon. It can trap moisture. You're going to sweat, especially in the hot weather like in Africa. You will sweat, and then the place will now be moist, you know. So you don't want to do that. Now, that's number 5. Number 6, avoid irritants. Be very, very cautious of the products that you use, like scented soaps, vaginal douches, or feminine sprays, feminine hygiene sprays. Be very, very careful. Some of these things that women use are not even medically advised. So inshallah, be very, very careful, because it can also irritate the urethra. See, UTI starts from the urethra, because the urethra is like the opening of the whole tract. You understand? So be very, very careful. I do tell people that UTI is very, very easy to cure. Some women will complain that they've been taking a lot of antibiotics, but it keeps reoccurring. I tell them, yeah, it keeps coming back because the antibiotics you were taking can only help to heal what is inside, but you are the one that is in control of what goes inside. You understand? What is already inside can be cured, inshallah, by the antibiotics that are being prescribed to you. But then the antibiotics cannot control what goes inside. So what goes inside should be controlled by you. You should make sure you do the washing properly. Don't do this. You should make sure you dry your toilet seat. You should make sure wherever you are going, especially if you know that you are going to use a public toilet, have toilet tissue with you. You should make sure you drink a lot of water to flush it out. So if the antibiotic is treating the inside and you are still doing this, it's not going to be effective. It will be like somebody digging a hole and you putting the sand back to the hole. Like, this person is digging this hole and you're just returning back. Like, you returning the sand back to the hole, like, it's useless for you to do that, because this one is now digging, and this one digging is very useless for him to continue digging, because you keep bringing back the sand. So this is how it is. If you don't maintain good hygiene, the antibiotics will be very useless. But of course, if you maintain good hygiene, the antibiotic will be useful. And also make sure you complete the dosage. A lot of people don't like to complete the dosage. If you've been prescribed to complete this amount, let's say 2 weeks of taking antibiotics, or 1 week, make sure you take the whole dosage, inshallah. Then practice good hygiene. Inshallah, this is what we have for this episode today of part 2. Inshallah, in part 3 we will talk about how to recognize signs and symptoms of UTI, and also what are some of the things that we can do to protect ourselves from reoccurrence UTI, like how we can stop UTI to reoccur, how to stop it from reoccurring, inshallah. I hope this is beneficial, inshallah. Please feel free to share any tips or any experiences you have, inshallah. Let us continue to watch out for each other, inshallah. This is what we are here for. And inshallah, we will make another part, inshallah, to continue with the topic, inshallah. I hope we all benefited, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.